Hello and welcome to this series on releasing tension in the jaw. We're going to be focusing on different parts of the body that also might contribute to pain within our jaw. And pain within our jaw can be anything regarding tension, teeth aches, jaw pain, headaches, migraines, neck tension. All of that kind of stuff can really contribute to the tension around this area. So do stay tuned for the series of videos, and you can like and subscribe, and that's going to really help me to continue to make this content as well. So I really appreciate you doing that. And we're going to go ahead and get started on today's video, which is just going to be really focused on relaxation techniques. We know that stress is a huge component when it comes to tension in our body and any muscle. So we can get caught in this kind of feedback loop, or tension feedback loop, right? Where we feel tension, that sends a signal to our brain that tells us that there's something stressful going on or there's some kind of impending danger. And then our body responds by creating more tension in the body, preparing us for action. And if we don't actually get a chance to release that energy, that may get held within the body again, and we get stuck in this kind of feedback loop. So we want to help to almost break that feedback loop, to release tension in a very somatic way, a very gentle way, to help to restore a bit of relaxation throughout the body, throughout the nervous system as well. So let's go ahead and get started. All right, so all of today's practice can be done from sitting on your chair or onto a bolster like I'm sitting onto today. Just really come into a position that feels supportive for you. You might even like to have your back resting against a wall or the back of your chair, however it feels just really supportive for you and your body. Yeah, that's going to be a big component of this as well. So I'm just going to start by, feeling and sensing into my sitting bones, how they're positioned in space, and then thinking about the rest of my back body. Does it feel a little achy today? Is there any tension? Do you want to move a little bit or wriggle or even take a little twist before I get started? And how can I make myself a little bit more at ease in my own body? Yeah. And that can be challenging some days. So we're just gonna work with whatever is present today. Yeah. So I want us to initially start off just by kind of feeling and sensing into some of the muscles that are involved in tension around this area. So today we're really focusing around the head area. If you take your fingertips just to around this area here, and we're going to feel into the temple. So there's muscles around this kind of temple area, and if you gently clench your teeth, you're going to feel those muscles switching on. That's actually really hard to do while I talk, so go ahead and try that. Just a little clenching, and you should feel those muscles switch on. It may be that one side feels a little bit more engaged or active than the other, and that's totally okay. That's totally normal, and it's a really interesting observation to make as well. It may be that both sides feel really evenly kind of engaged, or you might even notice that one side switches on a little bit quicker than the other, and that can be really interesting as well. And then you're going to just take your fingertips just the inside of your ear here, and we're going to just gently open and close the jaw. So as you do that, again, you're just kind of sensing into what's moving first, if one side is moving first, just as a kind of observational tool to feel maybe where there might be some tension patterns held within our own body. And this is just about getting curious about how our muscles move, how our joints move, and where we might be holding those tension patterns, okay? So now we're going to start just by doing a little bit of breathing. So our breathing is so connected to our nervous system, and particularly when we exhale, we help the body, the nervous system, come into a more kind of relaxed state. Yeah, sometimes for some people, but not all the time. Okay, so we always want to keep in mind that all these practices are very individualistic. So really listening to the feedback from your own body, noticing if this feels relaxing in your own body, and then choosing to engage with it or maybe take a little break from it. Yeah. So we're going to do a practice called the Autonomic Sigh, and this practice really kind of utilizes this power of the exhale to come into a more parasympathetic state. That's rest and digest, right? So we're going to take a nice breath in, and then a little extra inhale, and then as we breathe out, we'll open the mouth and let that breath move out. You can create an actual sound with that if you like. Some people like that, some people don't. So again, just see what feels really good and really comfortable for you, yeah? So just allow yourself to, again, come into your body, feel your seat on the seat that you're on or on your bolster. And we're gonna take just a normal breath in and a normal breath out. And then we're gonna do 3 rounds of this autonomic sigh. Taking a breath in, fill up your lungs to the capacity that feels comfortable for you. And then take a little extra breath in, and then breathe out through the mouth. You can do this with your eyes open or closed. Take a deep breath in, fill up, front, sides, back. Take that little extra breath in, and breathe out through the mouth. Last round like this, breathing in, filling up, front, sides, back. Small extra breath. And breathing out. Take a moment just to sense and feel, to notice. What do you notice now? Was it effective? Did it make you even more stressed maybe? And then that's a good indicator as well to know maybe that exercise wasn't quite right for today, yeah? Okay, our next little bit of practice is we're gonna do a little bit of myofascial release. So myofascial release is about working into the fascial connective tissue layers of our body. And a really great way to think about this analogy comes from Ida Rolf, who is let's say the queen or the creator of Rolfing, which is one of these, the first kind of major works within the field of fascia and fascial release. So we're gonna take hold, and you might start on the side. Sorry, my mic keeps flipping over. You might start on the side where you maybe noticed there was a bit of tension. Maybe you noticed that side of your temple muscle started switching on a little bit more, or maybe the jaw clicked a little bit on that side. So you could start there. And we're gonna just take a little bit of skin. So it's more than the skin, yeah? You're kind of grabbing a little, almost like a little roll. And we're getting into that fascia by starting to roll all the way up. So keep hold of that same roll. So I keep a little bit of pressure upwards and try to move towards the camera. And then with the other fingers holding it, and we roll that same little place all the way up. And you can go all the way up towards the temple if that feels comfortable. You can do this without oil. Yeah, it's better if you use this technique without any oils on the skin. We're gonna just do that a few times, assuming that it feels all good. So we've caught hold of that little bit of fascia, and we're skin rolling. That's what it's called. Skin rolling all the way up to the temple. And you can kind of move along, moving more towards the ear. As you go all the way up. You might notice there are little bits of tension. I notice particularly around my temple area, there's some tension there. And then just take a moment just to notice and feel that side. Yeah, make sure that it feels okay, yeah. Or maybe you notice some kind of release or a little bit more space. Okay, we'll come to the other side. So again, picking up that little roll of fascia. So we are, of course, picking up the skin, but it's not just the skin, yeah? We're picking up the deeper layers of fascia. And that's gonna help to release deeper layers of tension. So Ida described it as, if you think about making your bed, if you were to just make the top layer of the bed, right, just put your duvet cover over, you might find that the sheets beneath are all like crinkled up. So if you just do kind of the top layer, like so say just superficial work, then the lower layers might still have little creases in them. So fascial work helps us to get into those deeper layers, those layers under the duvet where the sheets are. It just helps us to release out any maybe little fascial adhesions, little tight spots of connective tissue. And ultimately, that can help to release tension in our muscles, because our fascia wraps around the muscles. Okay. So once you've finished on that side, again, just take a little moment to notice and feel. Good. Our last practice for today is we're going to do little fascial ear pulls, okay? So we'll start just at the bottom of the ear, yeah? And we're just going to do, you can do one side at a time, or I'm going to do both sides. We're going to just do little tugs of the ear. So I've sort of hooked my finger into the ear and I'm gently tractioning down. And just notice where you feel that along the fascial web. So I'm feeling a little pull around my temple area. And then I'm just going to keep moving up. So inserting my finger just a little bit higher. And this time I'm pulling back. And I feel that a little bit more forward, sort of into this area here. We'll do that all the way up through. So as I move more upwards, I'm going to start to pull upwards. So I find it easier to bring my thumbs to hook into the top there and gently pull up. And I'm feeling that all the way along my jaw here. But notice where you're feeling it, yeah? You may or may not feel it in the same place. Maybe, you know, it's feeling quite free for you today, and that's perfect as well. Good, you could even take hold of, I like to grab just the top of the ear and sort of pull, this time forward. Kind of feel around the back of the ear area. Nice, and then gently release. Have a little notice of what you sense and feel around the ears, around the jaw. Good. If you enjoyed that, please take some time to like or drop a comment below. Let me know what you enjoyed the most. And do stay tuned for the following videos where we're working more with jaw tension. Have a good one.